Welcome to Dental Vibes. I'm Gabby.
And I'm Carla.
And today's video is sponsored by Garfield Refining. Garfield Refining has been ranked the #1 dental scrap refiner in the entire nation. They work with thousands of dental assistants, helping them earn the most for their dental scraps.
Garfield Refining offers many benefits to dental professionals, making the refining process super easy and profitable. In case you're unaware, dental scrap contains precious metals that can be melted down and refined for profit, and there are companies that will buy it and recycle this metal and turn it into dental materials.
Offices have earned enough through scrap refining to fund new equipment and supplies. So this makes a great opportunity for dental assistants who don't refine, or for the ones who have worked with go-betweens to exchange their scrap for cash.
Because Garfield takes out the middleman, dental professionals can expect a larger payout, but this is not the only reason why we like to refine with them. They also have a state-of-the-art automated shipping process that starts when you request your first refining kit.
The starter kit includes your prepaid shipping label in a container for storing your scraps. Once you're ready to refine your scraps, just get your prepaid shipping label on and ship it to them. Their customer service will be updating you through the entire process. Once Garfield refines and values your scrap, you can expect payment as little as in 2 business days.
Refining with Garfield is a guarantee that you will get the most for your scrap. They do all the heavy lifting, so just ship it to them and get paid. So make sure to check them out. We're gonna leave their link below, and you can also go to our Instagram page, and if you click on the link in the bio, you will see their website for more information. And when Dental Vibes followers fill out the form at garfieldrefining.com/dentalvibes21, they'll receive 50% off all refining fees.
Now, let's get this video started with the crown prep. For a traditional crown setup, you always want to start with your materials for your impressions and your material for your temporary crown, and of course your trays. So here I have my material to take my preliminary impression. Depending on which tooth you're doing, obviously you're gonna get the tray that goes with that tooth. This is an interior one, this is for a posterior. Maybe it'll get the first premolar there, but for my preliminary impression, I like to use a triple tray. So after that, you want to make sure to get your final impression materials. I have heavy body here and I have light body, or they are going to be used together for the final impression. Depending on the doctor's preference, if they use a triple tray, that's all you're going to need. If they use the quadrant, then you want to make sure always to get an opposing and a by registration to send it to the lab. Here we have our provisional material. Okay, now here we have the instruments. Of course, the instruments are going to be different in every office, so you want to make sure to get with your lead assistant or with your doctor to discuss what kind of instruments they like to use, what kind of burrs they like to use. But this is pretty much what we use in our office. We keep all our instruments that we're going to need all packed together, which you're gonna have your syringe, your Explorer, your mirror, cotton pliers, things like that. And then our burr blocks, this is the same that we use for every crown prep. And then here we have a high speed and we have a slow speed just in case. We don't always need it, but it's always good to have if your doctor uses the slow speed. We have a shade guide so we can select the color of the crown. And we have suction tips. Talking about suction tips, if you're having trouble suctioning, make sure you check out our video. We do have a video that gives you tons of tips on suctioning.
So moving on with the remaining materials, of course we're gonna start with anesthetic, and we have there our topical anesthetic that you apply with the cotton tip, and then your needle and carpules, whichever one your doctor uses. The doctor's gonna move on to preparing the tooth, possibly removing the cavity that's there. Some doctors like to use our caries indicator, so you have it there. And then you move on to building up the tooth, and you can use, there's 2 different methods. You can use composite, so if you use that, then make sure you have the edge, your bond, and the composite. Or if they use something like a glass ionomer, you need separate things for that. Both things are light cure, so that's why we also need to have available our curing light. And of course, as usual, some floss, gauze and cotton roll so that you can isolate the area. Make sure to always, again, we can't say it enough, talk to your dentist to see what he or she uses. Now, before we take the final impression, there could be some bleeding there, or we need to retract the gums to expose the margins. There are several ways that we can do it. First, to control bleeding, we use Viscostat. Make sure that bleeding stop. Sometimes we may have to use this product, Traxident. It's pretty good to stop bleeding, and it also retracts, and it comes with those little different type of cotton, not a cotton roll, but something that you put on the tooth and bite on. And then you can also use the cord, good old cord, and of course you soak the cord with the Hemodent that comes with. And then you can also use a laser, and there's different type of lasers. Which type of laser do you have in your office? You have to make sure that you know how to set it up. And last but not least, of course, you will need your temporary cement for after you are done with the temporary crown, and you can cement it. And also you check the bite with the articulating paper.
And if you have been enjoying this video so far, make sure you give us a like.
Yes.
We are counting with everybody's support so we can keep bringing these videos for you. And also make sure you leave us a comment if your setup is similar to our setup, and if you have anything different in your setup. Also let us know in the comments.
Okay, now let's get started and talk about the steps of the procedure.
We're gonna jump straight into these steps because there's a lot of steps.
Yes.
So we're gonna start with our preliminary impression. Make sure that you watch our temporary crown video. We'll give you some tips if you have a situation where the tooth is broken or there's an irregularity or something like that. You make sure to fix that before you take your impression.
Yes. It'll make it so much easier.
It will. Then after your impression is ready, you are going to numb the patient, of course. You place the topical, the doctor will come in, get the patient up. After the patient is numb, you're going to start prepping the tooth. If the tooth has a cavity, obviously you're going to start cleaning out the cavity. Sometimes the doctor will like to use the caries detect to make sure they clean all the cavity out, and then you start prepping the tooth. If you are replacing an existing crown, then the doctor is going to section that crown off. And remember, very important, you're not going to throw that out.
away.
If it is a metal or a gold crown, you're going to save that, and you're going to send it to a company, and you're going to get that money, honey.
Yes.
Okay? So make sure you don't forget to do that. And then you go ahead and prep the tooth, and then, you know, either you're going to put a build-up or not, and I'll hand it on to you.
Yeah, so if there's like a big cavity that was removed, of course, you can't just put a new crown on like a hole. So that needs to be restored back up with the build-up material of your dentist's choice, and then they re-prep. Now, if it was like a virgin tooth that maybe had like a chip cusp or something like that, and that's weird, something like that, then they'll go straight into prepping, no build-up necessary, so you need to be ready for that. And then, okay, so we're gonna get ready for the final impression. You need to evaluate how the tissue is looking. Sometimes it's like perfect and you like, boom, okay, skipping on to taking the final impression, but it could be bleeding. Maybe you need to retract the tissue to expose the margins a little bit better. So for that, we kind of already talked about it earlier in the video, what you would use to control the bleeding. Or if you need to retract the tissue, you know, of course, packing cord, maybe using a laser, maybe do a full-on gingivectomy, whatever it needs to be done.
So get with your doctor or your lead assistant to see what your doctor usually likes to use in that situation.
So now with the final impression, we're taking a traditional impression. Make sure you have your tray ready to go, and that you have light body and heavy body both
go together.
Take that final impression. Make sure you know your setting time. Then after that impression is done, check the shade. What color is the new crown going to be, right?
Or just go with A2. That's the universal shade.
Yes.
It's gonna be fine. Don't blend right in.
Especially posterior.
Yeah.
And then the tricky part, this is where all of us dental assistants shine. You gotta make the temporary crown. Don't forget to watch Gabby's video. She gives you all the steps you need to make a basic temporary crown look awesome.
Make sure it looks nice.
Yes.
Make sure the bite is right, so you don't have any issues of this temporary coming off.
Yes. And
or breaking it, or something happened to it. Yes.
Yeah, make sure it's cemented well. You remove the temporary cement really well so you don't have issues with the tissue later on. And then you give, of course, the patient post-op instructions.
Then the last thing you got to do is probably write the lab script.
Yes.
So the lab is going to need all the information to make this crown. You attach it to your impression, you send it to the lab so they can make the crown. Usually takes about a week or 2 weeks for the lab to make the crown. When you get the crown back, the patient comes back for a crown seat and you deliver that crown and call it a day.
Yeah. Wow, so this is a lot, and this is like heavy procedures. It does require a lot of prepping and a lot of materials. So make sure you're ready. We hope that this video helps you when you go into either your externship side or your working interview. And you know that this could help you. You can apply everything that you learned here.
Yeah, and as always, make sure you like our video, share it with your dental friends, subscribe to our channel, please. Show us some love.
Yes.
And we will see you guys next time. Keep smiling.